So we've got Christian Buckland presenting discrimination against the COVID unvaccinated. So Christian, if you'd like to begin.
Thanks, guys. Okay, just trying to share the screen. Can we all see it okay?
Yep.
Cool. Well, thank you all for listening to all the talks today. I'm wanting to discuss a topic that often gets very little attention, even when it comes to talks and discussions on equality, diversity and inclusion, which is why I'm extremely grateful I've been given the opportunity to discuss it here today. The world has become an extremely divided place over the past 2.5 years, and this division has led to a new form of discrimination based upon medical status, against those who chose their legal right to not take a COVID-19 vaccination. It is essential that we start to heal from some of the societal splits that have occurred, and in order to do that, we need to look back at what has taken place with an open mind and be willing to ask uncomfortable questions and engage in difficult conversations, which I hope all of us here today as psychological practitioners are used to doing. So the world has become extremely split and divided over the issue of COVID and vaccination, and it is essential that that split is recognised. As clinicians, we regularly deal with splitting in our day-to-day work, whether it's a split within the multidisciplinary team or where there's a split within the inner psychological world of the patient. Practitioners have to know how to work with splitting, and we know that it is essential to good therapy to not ignore any split. Instead, we must acknowledge it, shine a spotlight on it, often through the use of psychological interpretations, and talk through the split in a co-constructed manner, and aim to bring the fragmented pieces back together. It is essential that we address the split in society in the same way and not hide away from it. And in order to start to heal the fractures, we must first understand how and why the split occurred. So one major reason for the split relates to the topic of informed consent. In the UK, receiving any form of medical procedure, including vaccination, requires giving informed consent. According to the UK government, consent must be obtained before starting any treatment. This includes the administration of all vaccines. Public Health England go on to state, for consent to immunisation to be valid, it must be given freely, voluntarily, and without coercion. Therefore, it's important to try and understand what coercion means. And as we can see from the Encyclopaedia Britannica, coercion is the threat or use of punitive measures against states, groups, or individuals in order for them to undertake or desist from specified actions. Continuing, it states threats include psychological pressure and social ostracism. So from understanding this, it's clear that informed consent free from any form of coercion, including psychological pressure and fear of being ostracized socially, is required before taking the vaccine, and that any coercion negated the ability to give informed consent. And we also see from this, it was every person in the UK's legal right to not take the COVID-19 vaccine for any reason. And there were many rational reasons why people chose to not take the vaccine. And just some of those reasons include the ones I put on the screen. That many people conducted their own risk assessment based upon aspects such as age, pre-existing conditions, and recovery rates, and decided for their unique situation, the risk of vaccination outweighed the benefits. Others believed in the tried and tested method of natural immunity. There were also concerns surrounding the safety of these vaccines as they utilize a different technology to the old traditional vaccines. And the claim made by governments and the manufacturers that COVID-19 vaccines stop transmission quickly turned out to be untrue, based upon reputable scientific studies. Therefore, there was no benefit to other people if someone took the vaccine. There were also many ethical, personal, and religious reasons, including the testing on animals, animal content, and the use of human fetal cell lines. There are also numerous psychological reasons, including knowing a family member who was injured or died from this vaccine. There are also minority groups who have personal experience of unethical medical experiments conducted in the past, such as the Tuskegee syphilis study. We've also got many people who have grave concerns that science has been politicized and become corrupt and captured, becoming more like a form of authoritarian science, with the science being deployed to buttress the mainstream viewpoint being methodologically highly questionable and crassly positivistic. And the last reason I want to highlight as to why some people didn't take the vaccine is simply because they did not want to, and that is their legal right. So we can see there were many and diverse reasons for not taking a COVID-19 vaccine, and everyone had the legal right to say no. Therefore, I contend that anyone who then attacked, punished, ridiculed, ostracized, or threatened them for choosing their legal right to say no was acting in a discriminatory manner. And to highlight the levels of discrimination, I've got just a few examples here. So first of all, we see Piers Morgan wanting to deny anyone unvaccinated any form of healthcare, and former Sunday Times editor Andrew Neil wanting to punish them. Former Health Minister Edwina Currie not wanting to be near anyone unvaccinated. Esther Rantzen wanted to deny healthcare to anyone who didn't take the vaccine or doesn't keep up to date with their booster shots. And this highlights that once authoritarian thinking commences, it can quickly become all-devouring, just as Hannah Arendt writes about in the book The Origins of Totalitarianism. The discrimination displayed here is now to deny healthcare to anyone who does not keep up to date with their booster shots, not just the people who didn't take the original two. We also see another presenter stating she wants the unvaccinated to wear badges to identify them, which is reminiscent of totalitarian crowd psychology thinking we have seen before. We have a former UK Prime Minister calling people idiots, and a current Member of Parliament calling people selfish. If any of the comments I've just listed had been directed at any other minority group in society, I'm confident there would have been public outrage, demands for resignations, and potentially criminal charges brought against them. Unfortunately, it was not just television personalities using shame, punishment, and ostracism as methods of discrimination. We also saw members of the psychotherapeutic community acting in similar ways, both inside and outside of the consulting room. Some were asking their clients about their vaccination status. Some recorded it on questionnaires. Some therapists refused to see anyone unvaccinated. Some supervisors abruptly ended supervision due to not being vaccinated. We even saw a paper encouraging psychotherapists to disclose their vaccination status to encourage uptake. And even more alarmingly, we saw psychotherapists appear in the media recommending punishment and infantilization of anyone unvaccinated. This is extremely worrying, as we were already seeing the media and authorities going along with the government's use of fear, shame, and guilt. And now we also saw the psychotherapy profession itself being used to advance a government agenda of contestable merit and veracity using demonstrably unethical psychological tools. A psychotherapist discriminating against any minority group surely breaks multiple aspects of the code of conduct that they agree to uphold. And I've listed on screen just 2 points potentially broken from both BACP and UKCP to emphasize this. To highlight this even further, I've placed on the screen a response from the BACP dilemma page in answer to a therapist who stated she asked a new client for their vaccination status, and the client became angry and accused them of violating their human rights. And I've also placed on screen an important statement from the UKCP on diversity and equality. So we can see from the statements that BACP make it clear that discriminating against someone who is unvaccinated violates the protected characteristics set out by the Equality Act 2010. And that UKCP tell us that at no time can psychotherapy be used as a means of coercion or oppression. Unfortunately, this is exactly what many registered psychotherapists did. Even more worrying is that this form of discrimination is not only oppressive, it is dangerously coercive. Some people chose to take a vaccine out of fear of being judged, oppressed, and attacked due to the discrimination they witnessed on the television and potentially in the consulting room. As my earlier slides emphasize, informed consent must be free from coercion. Therefore, any person, including psychotherapists, who discriminated against anyone unvaccinated also interfered with their ability to give informed consent, which is extremely dangerous and highly unethical. A question therefore must be asked: did the psychological governing bodies do everything in their power to halt the growing nature of this form of discrimination? Were the therapists who did discriminate, who were brought to the governing body's attention, become sanctioned as per their ethical framework? And if not, why not? So how did this form of discrimination emerge, and why did it grow? One of the main reasons is by the use of behavioural science, particularly through the deliberate use of fear, guilt and social disapproval. It's documented that the UK government artificially increased the levels of fear in the public in order to change their behaviour without their knowledge. And this tapped into many people's unresolved death anxiety. The response to this dire existential threat meant many people have been acting from a place of fear rather than rationality, nudging them to act in ways that they would never have done before, and which may have been against their own self-interest and with no demonstrable benefit to the wider society. The deliberate use of social disapproval techniques permitted the media and authorities to shame and embarrass people into changing their behaviours. As fear and shame were government techniques, many people chose not to question the morality of their use and ignore the long-term psychological consequences, turning a blind eye to their ethical beliefs. This enabled groupthink to emerge until it became normalised and publicly accepted to discriminate and ostracise this minority group. It's also important to highlight that the anger expressed towards the unvaccinated is misdirected and misplaced. I believe it was easier to scapegoat the unvaccinated rather than direct the anger and frustration towards the government and pharmaceutical companies who were disingenuous with the truth. An example of this disingenuity relates to the fact it was known that the vaccines did not stop contracting or transmitting COVID, but the public were told they did in order to promote uptake. A statement from the White House COVID response coordinator in July 22 confirms this, where she says on television, "I knew these vaccines were not going to protect against infection." This deliberate manipulation demonstrates a clear example of the authoritarian takeover of science that many philosophers, such as Paul Feyerabend and Ivan Illich, warned about. A quotation from Illich encapsulates the dangers of science being politicized, where he states, "The institutionalization of knowledge leads to a general and degrading dependence on having people's knowledge produced for them. It leads to a paralysis of the moral and political imagination." The impact this has had upon psychotherapy is dangerously profound. Psychotherapy has historically prided itself on being the place where the unspeakable can be spoken. However, unfortunately, some therapists simply could not hear the words of their clients, and even worse, there have been therapists who promoted punishment and a desire to actively discriminate. This demonstrated their inability to hold unconditional positive regard for their clients, meaning their clients could be at risk of psychological abuse or harm. This form of discrimination also exacerbated certain minority groups already disadvantaged disproportionately in relation to mental health care. Psychotherapists acting in such an unethical manner has certainly caused harm, and it makes us need to ask a very difficult question. By psychotherapists acting in a discriminatory manner due to it being a popular and government-promoted form of exclusion, has psychotherapy crept even closer towards becoming an agent of the state? In closing, I'd like to say...
Oh, you're nearly there. Go on, a couple of minutes. Go on. Go on.
In closing, I'd like to say that I'm fully aware how controversial it is to raise these questions in an environment in which a Foucauldian regime of truth has been constructed around the COVID pandemic, meaning that anyone daring to challenge the mainstream narrative, including myself here right now, opens her or himself up to suspicion and ridicule, and at worst to demonizing othering. Yet surely psychological therapists whose stock in trade is to read and interpret beneath surface personal and cultural narratives need to ask as a matter of urgency, how on earth has modern culture allowed such levels of discrimination to occur at a time when it is de rigueur and almost obligatory to challenge discrimination of any and every kind right across society? I really would welcome any open, non-defensive conversation about what I believe to be this gravest of issues, the ignoring of which, in my view, would be a massive dereliction of our professional responsibilities. Thank you very much for listening to me.
Thank you. Thank you. So, very, very interesting and important subject. And I wonder if anyone has any thoughts, comments they'd like to make.
Well, actually, vaccination does reduce some of the transmission. Several studies have shown that. And a bit of shame is surely not as bad as giving COVID to your granny.
But that's one side of the studies, and there are other studies that say it doesn't. And I think this is the open debate that's been shut down. And I think this is the really important part that I'm trying to emphasize is these conversations need to be talked about rather than shut down.
Yes, precisely right. The talking about it is essential. There are, from the studies I read, there are far more confirming some reduction in transmission, not complete reduction, than saying the opposite.
Who pays for the studies though? Because it never seems that it's actually a very equal. Who pays for the science usually gets the response that they want from the science. Seems to be a general.
Yes, you're absolutely right. But look at the Cochrane. Look at the Cochrane system, and that'll probably clarify things for you.
Now, a couple of people with their hands up. Sorry,
I was just going to say that to you. Yes.
Okay. So, was the first person?
Denica was first. And then
Denica.
Okay, yeah. Thank you for your talk. I thought it was quite provocative. I do have a question. I think psychotherapists seem to have taken the completely different position from doctors, because doctors already in 2013 had this kind of guidance from the, I'm trying to put my camera on, had already this guidance like, look, you have to get you have to get your flu vaccination, etc., even although it doesn't give 100% protection, because you have to reduce even a slight risk of infecting anybody else. But the other side is that you can never refuse to see or treat a patient. And then I'm just wondering why it's so different for doctors in the UK than it is for psychotherapists.
In what way? Sorry, I didn't understand.
Because psychotherapists, I haven't heard any, say, UKCP or any other organization saying their members needed to be vaccinated. Well, the General Medical Council does. And on the other hand, the General Medical Council is very clear that doctors have to treat everybody, vaccinated or not, you just have to treat everybody. And that seemed to be, and that's also far more monitored. And I don't think it's monitored with psychotherapists. Is that because they are all in private practice?
I'm not sure really what. I suppose the NHS didn't mandate it. I had a feeling they couldn't mandate it because the uptake in London was very low because of the ethnic groups. So the NHS would have fallen apart if they had mandated it.
Yeah, because that's the NHS, but this is the General Medical Council who was mandating it. They didn't police it, whether people took up the vaccination, but I think most doctors were vaccinated. So hospitals could never refuse unvaccinated patients. And from your talk, which is actually quite scary, seems that a lot of psychotherapists have done so.
Absolutely. There are groups that have been set up for. I only found this out when I was meant to talking about this talk, but there have been groups that have been set up for people who have been kicked out of their own supervision for being unvaccinated and had to then try and find people that would work with them. So this has happened.
Yeah, and then I'm just wondering why UKCP and other organizations are not doing anything.
Sorry, can I interrupt? Because I realize we're going to have to stop soon. And this is a discussion that might need to go on for some time. Ali, I wonder if you're able to say whatever you wanted to say, the time we got.
Yeah, certainly can do that really quickly. It was just that I, during COVID and ongoing, I work with a group of military veterans, all of whom were really against having the COVID vaccination, and all of whom felt absolutely vilified by the world around them, and that they were being attacked and seen as stupid, and they were making bad judgments. And we had some really just interesting and fruitful and hopefully non-judgmental conversations around that as a group. And one of the things that they talked about was their experiences of being vaccinated kind of almost as guinea pigs while they're out in Kuwait and Iraq, and this was kind of standard practice for them. And so they had a very innate and understandable suspicion of vaccination programs. But and I was thinking about the shame that they felt at not doing that, and the comments that people made to them translated into a rage. And so they ended up being furious and acting as a group and being angry and protesting and all kinds of things because of what looked like a fairly reasonable decision on their part, actually. It's just really interesting, Christian. Thank you for bringing it up.
Good.
Thanks for the comment.
Thank you. Look, Gillian, you've had your hand up for a while, so please will you say something, and then we need to break very quickly because it's time. You got your...
Yeah, got it. I'm interested that you start, Christian, with critiquing splitting, and I'm completely with you there, but yet I found that you present in a very polarized way these issues, which encourages splitting. You present the science to be clearly either for or against vaccines, and I think it's not so clear at all. And for me, what the issue here is how we prioritize our own individual autonomy to make individual decisions, which may impact on other people in society. And so, you know, depending on what we believe about how we impact on people, it's how we present both of those things. So as a therapist, I've got the right to decide who I feel safe to see as an individual, and it's a relationship. So I think you're really presenting one side of the story here in a creating, splitting way.
Thank you for the feedback.
Can I, sorry, I've got to interrupt and say, thank you all for your comments, Christian, for your presentation. And maybe there's something we'll come back to in the small groups or in the plenary later on, but we've got to take a break now.